Hi, I'm Dr. Ganc. If you're complaining about sinus headaches, pressure, congestion, postnasal drip, and frequent sinus infections, and if you've tried over-the-counter medications and different antibiotics with no relief, you might have chronic sinusitis. The good news is that you probably won't need to go to the operating room for surgery, because at my clinic we specialize in balloon sinuplasty. In balloon sinuplasty, unlike traditional sinus surgery, the first step is actually finding the natural opening of the sinuses. I do that using a thin fiber optic wire that you can see here. This wire is so flexible that it won't even break an eggshell. If I'm not in the natural opening of the sinus, it will just bend and go the other way. When I'm in the right opening to the sinus, I then advance, guided over the wire, a catheter that has a very small balloon. When we're actually in the opening of the sinus, we're going to then inflate. Okay? We're ready to inflate. You can see the balloon inflates just to a maximum of just under 1/4 of an inch. Then we deflate, and the balloon and everything comes out. Nothing is left in the nose. No tissue is removed. No bones are removed. At this point, the patient has already taken medication by mouth to be calm and relaxed. I will now numb the nose with some medication that will be put onto a soft cotton patty. This will stay in the nose for a few minutes, and then we will remove it and start the procedure. Now we're ready to begin the procedure. This is the fiber optic camera that I use to look inside the nose. This helps me see exactly what I'm doing with my other hand, which has the instruments that I'm going to use to dilate the sinuses. I'm now going to use the light to help guide me into entering the sinuses with the device. Okay, all done. The procedure generally takes less than half an hour. Most of my patients go back to normal activity within 24 to 48 hours afterwards, and without any kind of restrictions on activity, either diet or physical exertion. Some of my patients walk out of here feeling like they can breathe better and their headaches are reduced. Sometimes it takes several weeks to get to our final result. But by and large, I've been really excited to see how well my patients do after the procedure, both in the short term and in the long term several years later.